So let me set a few things straight, okay? One reason why healthcare is so messed up in America is that private insurance companies are for-profit agencies, okay? Their bottom line is to make money, not to help people, not to make them healthier, just to make money. This is kind of like a car insurance company. They don't want someone who they know is going to crash and get in an accident and they'll have to shell out a lot of money for them. They want to choose people to insure who have a good driving record and aren't going to cost them a lot of money. The same way, private insurance companies make it difficult for the sickest people to get coverage, and they only insure young, healthy people. Or they charge exorbitantly high premiums for people who do have chronic diseases or pre-existing conditions.
Or if you have a part-time job or you're self-employed, the rates are way too high to afford since you just have to pay for it yourself. Humans are treated as assets, not as people. It might as well be a fast food company dealing with hamburgers. It takes a lot more overhead to run a private insurance company than a non-profit company that's sole purpose is to make people healthier. For instance, you have to pay the CEO's salary, you have to pay for marketing, and you have to pay all the claims people who are going through every case with a toothbrush to look for patients and look for claims they can reject, like my patient with pancreatic cancer.
Another reason our healthcare system is backwards or stupid is because it's based on employment, okay? So if you don't have a job, it's really hard to get insurance. If you work for a small business who doesn't have a lot of employees and a lot of negotiating power with insurance companies, it'll be hard to get a good deal on insurance, or they'll charge too much to even afford insurance.
So really the only way to get insurance not through your employer is if you're very, very low income and then you get Medicaid, or if you're 65 or older and you get Medicare. Another industry that drives up healthcare costs in the US much higher compared to any other country is the pharmaceutical industry. Drug prices are much higher in America than any other country, about 60% higher. Pharmaceutical companies have the highest profit margin of any American corporations. It's about 19%, compared with about 5% for the average Fortune 500 company. Data from drug companies' annual reports shows that they spend 3 times as much money on marketing and administration as compared to the amount they spend on research and development. So these high costs, which don't exist in other countries, combined with the lack of access of uninsured and underinsured Americans, combine together to create the disaster we call the American healthcare system. Click here to proceed to a more general theoretical explanation of the healthcare reform legislation. Click here to proceed to a detailed, specific explanation of H.R. 3200, the proposed healthcare reform bill in the House of Representatives.